On the occasion of International Youth Day 2024, the Meghalaya AIDS Control Society, also called MACS, will be launching the intensified IEC, which is called Information, Education and Communication Campaign, which will be a 2-month-long campaign solely to spread awareness on HIV/AIDS. Let's take a look.
With the theme From Clicks to Progress, Youth Digital Pathway for Sustainable Development, MACS aims to spread awareness through various platforms and methods. One being social media. The main objective of this campaign are to enhance knowledge and understanding of HIV among the general population to promote safe practices, reduce stigma, and create demand of HIV/STI services.
Today, the 12th August 2024, Meghalaya AIDS Control Society, along with the rest of the world, commemorate this day as the International Youth Day. The theme of the day is From Clicks to Progress, Youth Digital Pathway for Sustainable Development. Digitalization is transforming a world offering unprecedented opportunities to accelerate sustainable development. Digital technologies are instrumental in advancing the Sustainable Development Goals. In line with this, National AIDS Control Organization, under the Ministry of Health and Family Welfare, Government of India, has been implementing the National AIDS Control Program by providing HIV/AIDS prevention, testing, and treatment services, and aim at ending HIV/AIDS as a public health threat by 2030. Although HIV prevalence in the country is low at 0.21%, but there are 25.44 lakh people living with HIV, and 18.06 lakhs are on ART treatment. New HIV infection, that is from April 2023 till March 2024, is 68,450. In Meghalaya, the adult HIV prevalence is higher than the national average, which stands at 0.42%. Number of people living with HIV as on June 2024 is 9,130. Those started on ART treatment, that is initiated, is 8,354. Those who are alive and on treatment is 6,250. New HIV infection, April 23 to March 24, is 1,524. And the comprehensive knowledge of the people of a state on HIV/AIDS, according to the National Family Health Survey 2021, is only 16% among females and 17% among males. These figures underscore the urgent need for intensified efforts to combat HIV and STI epidemics. In order to enhance the knowledge level of general population, especially youth, and equip the masses with correct information about HIV and STI, a 2-month intensified IEC campaign spearheaded by the National AIDS Control Organization will be launching today across the country in all states and union territories through State AIDS Control Society.
Despite the tremendous progress that we have made in the fight against HIV over the years, the battle is far from over. Every day we have new cases or newly diagnosed cases of HIV that are reported, and that too, I believe, the data that is available with us is just a tip of the iceberg, because not all of us are willing to come forward to know our status, to undergo testing for HIV. Why? Why is this? Because many people are unaware of their HIV status. Hence, this intensified IEC campaign is being flagged off today, which is a 2-month-long program all over the state to empower the people with the knowledge about their own health status and where they stand, especially with regards to HIV status, especially for the high-risk groups, because knowledge is power. It will help us to protect not only ourselves, but also to our dear and loved ones. Lack of awareness not only puts individuals at risk, but it also contributes to continued spread of the virus. Ignorance about HIV is a dangerous thing. It fosters stigma, discrimination, and fear, which in turn discourages people from seeking testing and treatment, which they need. Awareness is crucial to dispel myths and misconceptions, replacing them with the facts, and that a clear understanding of how this virus is transmitted, how it can be prevented, how it can be treated is very, very important. Knowledge is truly power, and in this case, it is the power to save lives.
Meghalaya Health Minister Dr. Maisel Ampreen Lyngdoh graced the occasion as the chief guest and also launched the campaign. In her speech, Lyngdoh emphasized the need for more tests to be conducted to detect HIV/AIDS cases in the state.
Ki samla jongkari ki dei ka borba nakabanta ka laway jongkari nakatakadaw ka longbadon kampalan baki kun samla jonishwa ki snotho syapang ka jingpang HIV/AIDS menei cardenas ilapun sotho ini ya kata ka jing shisha ba ki priu ki ba im bat uni uknyang jingpang ki don la ka hok pan im nakalyang jong ka sarkar ya pi ki ba don kata ka challenge Bapipang HIV/AIDS, lalipidiki people living with HIV/AIDS, nakalyang ka sarkar, ngin persyangkat balak, bandon nakabenta jongpi, hakajing im ka jongpi, bat pi ki kon ki benang puli haki skul, ki kerdan puli ki baper, to shimnya kami, bakani kedai kata kerensan hakaba andon banyak khana bat pi ban pensyai ya pi syapang kata ka HIV/AIDS kalong kabakthang gadonun habang ngitip bala kumno khandai hajar sispa lai pomut napreng kita ki bangila tipsyai ki badai ki HIV/AIDS people but kabak kham khuslai but kham kthang mensem yangi kum ka sarkar kalong kum no pan ngin yoi bat yakando yaki weipat ki batang yakan testing ru kim patre banle kanu ka sarkar habakadon kanu ka problem habdon shwa ki pat shongsnong ki ban tre lengkat ban penbek ya kata ka jingduna ka pasdang ban terlep ya ka jella ka jongi para kawai nginumla ban mudur ba kani ka jingpang HIV/AIDS kam kata tang ya kita kibab yo niu kenyang jingpang mereka kata ru yo ki kun ki kti ki jongki but hakajala berok away. Tang na pedeng ki bangila syai but tip don lakumno saus pa tam ki klung ki kena. Ki bapang HIV AIDS. Ladakum ki long song slong jong kajala. Ngi kwa ban penbet ya kani. Kabaning kong kalong. Ban khot ban yawer. Ban council. Ya baro kita ki vulnerable groups. Ki badon saudong jongi ban wan syakman. Ban desno ban tipno dakabasyay. Lada ki day ne ki people living with HIV AIDS. Boong ikadinus kadai kabashisha. Kamday kajing shisha. Bayaki bapang HIV AIDS. Habbu siya kendong bat kang yaki hakaway ka kamrang. Kiniru kiday kinong song ki badan yala ka jong kahok. Banyo ya ka jingim ka bapura. Bat ngi kum ka sarkar bat kinong song jong ka jila. Ngi day banwan siya kamat. Ban yaram. Ban tip. Bat ban syarai pat kumno ban le. Nakabenta ban pendo jad ya ka HIV AIDS. Haka jila kabayit ka jongi. Ngangas ngo ba ban beg bat ban yarap ban ya syakmat jong ka HIV AIDS. Ni don kam kerke yaki kon samla jongi. Bakin ya kana syapang kilat jing ai jing yala. Bunsin ngim klong ki bakloy kinong song ban ya kana. Bunsin ngiong naikren syapang ka HIV AIDS. Henry ngasngo baladangi kum ka sarkar ngila banle ban rat ding kong ya ka jingpang HIV AIDS. Ngidon kam shwa ya kinong song ki bela pengkre ka jingbut ka jingperkan. Ban yarap yangi ban lum ban lang ban research bat ban wat kumno bat kae ngidon kam banle ban pet baka jela ka jongi ngi handle lani ngi face ya ka jing shisha baka HIV AIDS kalong ka next big threat ka jing pen ma ya ka jela jongi hi berok away ladadon kino kinong song kibadon kam ban leg ya ka testing ngim day ban shame yaki ngim day ban nyat yaki shushu syakaway ka kendong ka bedum henray ngi day ban yarap yaki ngin sedang shwa yakani da ka bangi sensitize yaki health and care givers hakicaka basumar baper jumi IDHS bat kitim jong pi day ban wan ka kabaduna haki CHCs ki PHCs ki health centers ki ba penpet syajngai ya kum kini kinong sosnong bat wan lam shu ki jingma nakabenta ka imlang salam ki kon ki ti ki jongi nakaliang ka jonga ngakit bok kit wiang yaki nong snong jong ka jela ba jongi ba pinyo ya ka jing im ka bakot ka bakya nakaliang ka jongi ladadon kano ka jing duna long ki bakloy banwan ka du yingi nang manginla ban face lang ya ka ni ka problem ringkan ban fi ki institutions don come ban don programs kaka madam namadday kato ka breeding ground of temptation. Kam tang in a family, kadayru in the institutions, in a life of a person in his workplace, ngidon kam One happening kinong tre sorkaro, bapin don ki awareness programs. Kenang bakan don ka healthy life, healthy practice. But baladana badon kanu lani mano badon ya kata ka jimpang HIV/AIDS. Ngim day ban penalize shu yaki nalor kata ka predicament ka bakila don lupa hakata kamet ka jongki menyerap yaki bakin kecing ka bakam biang yakini ki kun samla ni khot yapi ki netizens mentali lami sakawai ka kentin ki ong ki digital natives ngatarai don shu ki kun ki ba san snap shaneng ki bam kamtip ya ki mobile ne ka technology banyangi ki ki pawat ha ka juk jongaro ni kermen bapin pendengkam positively ya kata but ni kermen ba habadon ke digital innovation kan donru ka progressive mindset ka banyarap yangi ban face our problems together. Face our problems together without isolating anyone. Nakaliang bajonga, si hajar ngo o pikot yang asya kami ke program madam. Ban nga assure yepi ba ka government rengkat bagi teachers bagi team jungi brokan, but we will leave no stone unturned. We have to get the testing done. It is better to have a tag of having one of the highest HIV/AIDS rates rather than having unknown HIV rates. The known is better than the unknown. And
Health Minister also launched Hep Care Project, which is a community action for rapid elimination of hepatitis. It is meticulously crafted with determination and a shared vision for a healthier Meghalaya. According to project leader Dr. Kaur, she said that this program is tailored to meet the unique needs of people who inject drugs, and they aim to screen all the people who inject drugs who are registered with TI and OSC services with MAGS.
Ma'am, if you can tell us, because today we have seen the launch of Hep Care Project, can you tell us what is it all about?
So basically this project is for the community. So we are going to, strengthen the community to build capacities of them and screen them for hepatitis and, link them to care. So we would be recruiting like 50 peer navigators who are going to help us, screen the community, the people who inject drugs, and link them to care, because the linkage to care was altogether missing. So we are just going to fill in the gap there.
Today in your speech, I've heard you talking about, I missed out the point, but you were saying that if the government can make it for free. Can you just elaborate on that?
Yeah, so basically the baseline investigations, the basic tests which are required for patients to be started on treatment, they are not free in the state as of now. So we just made a submission to the health minister today that if they can be made free to the PVIT so that they can be initiated easily onto the treatment. But to give a strong start to the project, we are going to support the baseline investigations for the first 500 cases.
At present, what is the price for carrying out a check or a test on hepatitis? And do you feel people are reluctant to take the test because of the price also?
So basically the test is free of cost, and the treatment is also available free of cost, but in between, like, you have to get the baseline investigations done. That carries a cost with it.
You being the project director of MAGS, how impactful are you expecting this campaign to be? Because we're looking here is 2 months, it's not a 1 week campaign. So how effective is it that you're hoping for?
Yes, yeah, we are hoping that with the public support and with the support from especially the Rang Bashnong, because we are going to the village level also, and also in the schools and colleges. So with their support, I hope that it will reach the last mile. Okay.
Ma'am, in your speech today, you had mentioned that the rate of people living with HIV/AIDS in Meghalaya is higher than the national average. So, is that very alarming for the state? And also, there are children living. There are more than 400 children with HIV/AIDS. So, how is the Max looking into all of this?
Yes. You see, like we are higher than the national average. Our adult prevalence rate stands at 0.42%, which is higher because national average is at 0.21%. Okay, so looking at the entire state, like we have different districts, right? So the district which contribute more to the HIV population here is from 3 districts only, that is East Jaintia, West Jaintia and East Khasi Hills district. Actually, it's more in the East Jaintia and West Jaintia. Next comes the East Khasi Hills district. So we had done last year we had done this integrated health campaign at East Jaintia Hills district, where we had targeted the entire population, and we had gone to all the villages in the district of East Jaintia. We did this static camp where we have like a screening for HIV and also for hepatitis. Then for non-communicable disease, we do eye screening, and then we also do this like an NCD, like these BP checkup, and then for blood sugar and all that to draw more crowd. And with the support of the district administration, we also do Aadhaar enrollment and also for the MHIS enrollment. So we get quite a lot of people coming to these camps, and during the camps we did the free screening and free treatment, and also prior to the camp we conduct this awareness campaign. So we hope that in East Jaintia now, there are people who are coming by themselves for testing. So we hope that this campaign also now, because we'll be targeting the entire state, so we hope that other district also will be, will get the same response that we did last year. And now for this the integrated health campaign this year, we are doing it West Jaintia Hills. Yeah, last year we did in East Jaintia and Riphoi district, because Riphoi district is one of the aspirational district. So we did also in the Riphoi district.
Hi, can you introduce yourself?
Hello, my name is Eva. I'm studying from Law College.
Okay. What do you feel about the current scenario in our state with those living in HIV/AIDS? Do you feel that a lot of stigmatization is happening?
Actually, after hearing lots of, from that time, whatever the program has been stated there, I feel like, yeah, there is. Actually, I feel bad for those people, and I feel like, yeah, this is a very great opportunity, especially for us, the youth, so that we can also teach and give awareness. And also, we should not discriminate against those people, because they are also humans and they have the right. Yes.
And do you feel that much awareness is there, or what is also the reason that you all are participating in today's rally?
And I think so that, yeah, actually the government is trying by its heart, and even the MAC also is giving and trying its best. And now it's on us also, the youth, to also aware. Wherever we go, wherever we meet people, we should also advise them about all this.
I'm being joined by the Health Minister of Meghalaya, Dr. Maisal Ambreen. Ma'am, on today's program, you had clearly mentioned about more testing needs to be done. Can you tell us more about that? What is lacking right now?
HIV/AIDS can be a very compromising disclosure. So we are afraid that not all citizens are willingly taking the test. So you have these vulnerable groups. Individuals likely already know their own symptoms, but because of the fear of the disease, they withdraw, coil up, and choose not to test. We need not just a government agency that will address this underlying threat. We need people to feel comfortable. So we need everyone to involve themselves, whether it's the church, whether it's the family, whether it's the institution, whether it is the civil society members. We need to get on the same concern and encourage any vulnerable group to come forward and take this test, because it is only once we know the result of the test that you will be eligible for further treatment. We, on the part of the government, are going all out to ensure that testing is available at a closest location. After we are able to deal with actual disclosure of numbers, only then can we have proper policies planned out for this. What happens to a person living with HIV/AIDS? What are his or her difficulties? What the government needs to do to ensure that we assist them, give them assistance of any nature. Sometimes, because government is unable to know the actual numbers, we are also unable to come up with proper plan and policy. We have to get on the job and we have to do it. As of today, the numbers in the state of Meghalaya are quite alarming. 9,000 plus HIV positive people.
We have spoken at length with the authorities, and what we understood is that the adult HIV prevalence in Meghalaya is higher than the national average, which stands at 0.42%. The need of the hour is to enhance the knowledge level of general population, especially the youth, and equip the masses with correct information about HIV. With camera person Paul Lamare, this is Princess Rashir for DD Meghalaya.